Hello, today I am going to talk to you about some interesting queries related to your oral health that is most commonly asked by patients in a clinical practice. So these are doubts and questions that most of the patients ask us on a regular basis. So I thought of making a small video so that the patients can get to know a lot of information about most common queries. So one of the most important query that is asked to us is, does oral health affect overall health? Well, your mouth is a gateway to your body and it is to some extent the reflection of your overall health. And what do I mean by that? Any systemic issue, any medical illness, be it diabetes, neurological disease, any infection in the body, unhealthy gut, or your cardiovascular problem, definitely have a bearing on your dental health. Also, if there is a deficiency of any important nutrients and vitamins, that is also reflected in your overall health. So your mouth is a gateway to your health and all the parameters should be well controlled, and if your body is diseased or unhealthy, it will have a direct implication on your mouth and dental overall health. So whenever you go for dental treatment, especially the surgical treatment, dentist should and will ask you to produce your lab investigations so that all the parameters like the CBC, complete blood picture, the lipid profile, the thyroid profile, liver profile, kidney profile, serum calcium, B12 levels, vitamin D levels, they are all well in order so that post dental surgery the healing is good, the outcome is good, the quality of your repair of the bone and the tissue and the gums is good. So the disease have a direct bearing upon the outcomes on dental healing, so that needs to be very much addressed. The second question that is asked to us is that, are electric toothbrushes better than manual ones? Well, I have made a lot of educative videos upon the same topic and I have spoken a lot many times that the purpose of toothbrush is only to clean the plaque and tartar and food particles manually. You may choose to use a manual toothbrush, but it should be of medium consistency with a small head so that it can go to all the parts of the mouth. Whereas my favorite is electrical toothbrush because it has a small head. It has a sensor that beeps when you complete 30 seconds of toothbrushing. So you know now you need to switch to the other part of your mouth. And also the movement of electrical toothbrush is circular so that it doesn't cause much of tooth wear on your enamel. So that's about the electrical toothbrush. Many times patients ask us that, is tooth whitening safe for them? Well, I tell them tooth whitening is highly underrated dental treatment and it is underdone. I am a big fan of tooth whitening. I like to combine in office and at home tooth whitening treatment for my patients. In office is when a dentist use a slightly higher concentration of mild acid to do the value correction, the color correction of your teeth in the office. It lasts over a period of 1 hour. And at home is that when the dentist makes retainer like carriers for you which you wear over your teeth and place a small amount of whitening gel in those carrier and place it over your teeth. So that is very mild and corrective tooth whitening. Now the beauty of having at home tooth whitening is that it is a very preventive protocol because it not only whitens your teeth slowly, it gives you a total liberty of do it yourself. And what I mean by do it yourself, because most of the time you can use it whenever, suppose you have an upcoming party or a function and you need to slightly make your teeth whiter because you already have the gel, you already have the carrier, the trays, you can start 1 week in advance and slowly lighten up your teeth. So at home whitening not only makes your teeth look whiter and younger, the color becomes brighter, but also it is also gentle on the gums. So it is because the at home tooth whitening contains mild hydrogen peroxide that is antiseptic and it allows healing of the gums. Also urea, that is it has a component called urea in the gel that is helping further to prevent cavities. So in totality, home whitening along with at home or office whitening, a combination is a great things to go for and it is really a value addition. Next is, what causes bad breath and how I can prevent it. Most of the time patient wants to know that they have a bad breath, they want to see you for correction of a bad breath and they are worried about it. So I tell them bad breath is not only because of food particles or cavities and swollen gums or bleeding gums. It has also to do, you have a blocked nostrils or blockage in your ENT system, you have a middle ear infection, or you have a upper respiratory tract infection, or if you have a lung infection, or if you have a tonsils, they may all cause bad breath. So bad breath is a very wide subject, but from a dental point of view, the food you eat, especially garlic, onion, olives, the food that has a particular odor that may cause bad breath, so avoid eating them during the daytime and get your dental examination done, because if you have cavities which will trap food particles and then they become more acidic by decomposition, and they further cause decay of your tooth. So bad breath is something you can avoid by simply rinsing after every meal, getting a thorough checkup done, and getting all the cavities and gum corrected so that it doesn't worsen. Now the question is, what food are best for maintaining good oral health? Any food. Make it very simple. If we keep the pH of the mouth acidic, right, because saliva is acidic, if we keep it more acidic, so it's more harmful. So the thing is, any food which can neutralize the pH of the mouth or lower the pH, make it higher towards alkalinity, that's good. So sugar, starch, and jaggery, chocolates, all this food you may eat, but you should rinse immediately after that. But if you keep them in your mouth and if you munch between the meals, this is very, very harmful, especially when you eat at night. In the current online world, if you're working online and eating late at night and not brushing and sleeping, then that's disaster. So food that will help you are simply green leafy vegetables. A lot of water you should be drinking, and you should cut down on sugar and sugar related dairy food. Does stress has a relationship with the oral health? Yes, it does. Now what happens when you are stressed? An hormone called cortisol is released, and cortisol is not a good hormone. You do everything wrong, it causes more craving, you'll end up eating more, you'll end up eating more sugars, you'll end up worrying more, and then worrying more leads to eating more, and then ultimately your intake of sugar, consumption of acidic sodas and everything increases, nail biting increases, you start doing everything that is wrong. So indirectly, stress also causes you to grind your teeth, so further tooth wear increases, and then you may have painful tooth, painful headaches, and joint pain. So not only it causes you to eat more sugary food, but also tooth wear increases. That's a silent killer. Can I use natural remedies like oil pulling for oral health? Absolutely. Oil pulling is a great Ayurvedic remedy in our system. We can use it as an adjunct procedure for taking care. Any essential oil like coconut oil, cold pressed or coconut oil, or olive oil can be used for swishing for 2 to 3 minutes. You can hold it in your mouth, twist around well, and then spit, and then just rinse with a lukewarm water. So it is found to be antiseptic, antibacterial, and it removes all the washings of the soft tissues. So it is sort of helping to heal your gums. How do I choose the right toothpaste for my specific needs? As far as toothpaste are concerned, I understand that toothpaste are medicated and non-medicated. So medicated toothpaste are prescribed by your dentist to help you achieve a particular goal. The goal could be bleeding gums, gum inflammation, tooth sensitivity, and non-medicated toothpaste are available over the counter. They have only one purpose: to make you feel good by their the flavor, like peppermint flavor or clove flavor, and give you a fresh feeling. Now there are also tooth remineralization cream that contains a lot of minerals that your natural tooth is made up of, like hydroxyapatite, fluoride, calcium, and magnesium. All this type of toothpaste that contains minerals are called remineralization cream. These toothpaste, when they are mixed with the saliva and applied over the teeth, they increases the mineral intake of the tooth. Thereby the tooth becomes much more resistant to decay, and you feel better over a period of time. So you decreases your cavity, your overall quality of the tooth is better. So in totality, I have tried today to take up few most commonly asked question in my practice, and I have tried to talk to you in a most layman and simple manner so that you understand what is good for you. And I hope this type of education and my dialogue with my patients and for my community will help you fulfill some doubts about dentistry. And I always say that dentistry is a good science. In current times, dentistry is nearly painless, and it's a good thing that we get educated on dental issues. Thank you.